Good morning, and let me tell you something that might shock you. I'm 68 years old, and I have not taken a single blood pressure pill in my entire life. My blood pressure this morning was 118/74. No, I did not win a genetic lottery. My father had a heart attack at 62. My mother was on 3 medications by 55. Every cardiologist I know would have predicted I'd be on pills by now. But I'm not, and the reason has everything to do with 7 specific things I do every day. I'm Dr. John Dale, and I've spent more than 25 years in clinical medicine, specializing in geriatric care and cardiovascular longevity. I've sat across from thousands of patients whose doctors simply handed them a prescription and said, "Take this for the rest of your life." A landmark study in the Journal of the American Heart Association followed over 28,000 adults for 12 years and found that lifestyle interventions alone reduced systolic blood pressure by 14 points, comparable to a first-line medication. In participants over 60, the results showed a 19% reduction in cardiovascular events compared to the medication-only group. Stay with me to number 1. Because the single most powerful thing I do every day is something most doctors have never mentioned. It costs nothing, takes less than 10 minutes, and the research is staggering. Drop your age in the comments and tell me. Are you on blood pressure medication, and has your doctor ever discussed getting you off of it? I read every single comment on this channel, everyone. We're counting down from 7 to 1. From important to absolutely critical. Number 7, chronic dehydration. I know what you're thinking. You drink plenty of water, but by the time you feel thirsty, your blood volume has already dropped enough to force your heart to work harder. Think of it like this. Your circulatory system is a network of garden hoses. When plenty of water flows through, pressure stays low. When volume drops, your heart squeezes harder to push blood through the same pipes. A study from Tufts University found that chronically underhydrated adults over 60 had systolic readings 8 points higher than their well-hydrated counterparts. The practical takeaway. A full glass of water within the first 15 minutes of waking, before coffee, before anything. Then 6 to 8 full glasses throughout the day. Number 6, ignoring potassium. Everyone talks about cutting sodium. But here's what your doctor probably never told you. The ratio of potassium to sodium matters far more than sodium alone. Your kidneys use potassium to flush sodium from your body. Without enough potassium, the sodium stays, water follows, and pressure climbs. A study in the New England Journal of Medicine involving over 100,000 participants found that higher potassium intake was associated with a 24% lower risk of stroke, regardless of sodium consumption. I had a patient, let's call her Margaret, 71 years old, from Phoenix. 9 years on medication, sodium cut to almost nothing, readings still high. Her potassium was shockingly low. We added a banana at breakfast, a sweet potato at lunch, spinach at dinner. 6 weeks later, systolic pressure dropped 11 points. Margaret told me, "I spent a decade fighting the salt, and the answer was in the produce aisle the whole time. Aim for 3,500 milligrams of potassium daily from whole foods." Number 5, neglecting your breath. Your breathing pattern directly controls blood pressure through the baroreflex, your body's built-in pressure regulation system. Breathe slowly at about 6 breaths per minute, and you activate the vagus nerve. Think of the vagus nerve as the brake pedal for your cardiovascular system. Heart rate slows, vessels relax, pressure drops. A study in the journal Hypertension found that slow breathing for 15 minutes a day reduced systolic pressure by 9 points within 8 weeks, 9 points from breathing. I had a patient, let's call him Robert, 74 years old, from Atlanta. 2 medications, still reading 145 over 92. I taught him a simple technique: in through the nose for 4 seconds, out for 6, 10 minutes every morning. 3 months later, 1 pill instead of 2, readings below 130 over 80. Robert told me, "I've been breathing my whole life, Doc. I just never knew I was doing it wrong." Set a timer, 10 minutes every morning. In for 4, out for 6, through the nose. Number 4, magnesium deficiency. Nearly half of all adults over 60 are not getting enough magnesium. Magnesium relaxes the smooth muscle in your blood vessel walls. Without it, those vessels stay constricted. Think of a clenched fist that can never fully open. A meta-analysis in the American Journal of Clinical Nutrition reviewed 34 trials with over 2,000 participants and found that magnesium supplementation reduced systolic pressure by 5 points and diastolic by 3. Modest alone, but compounded with the other 6 items on this list, powerful. Take 200 to 400 milligrams of magnesium glycinate before bed, not oxide, which is poorly absorbed. Glycinate. It also improves sleep, which brings us to number 3. And right now, I want to pause. If this channel has ever given you information your doctor forgot to mention, hit subscribe and give this video a like. It helps us reach more people who need it. Costs you nothing. Number 3, poor sleep. I don't mean the hours. I mean sleep quality. During deep sleep, blood pressure drops 10 to 20%. This is called nocturnal dipping, and it is essential for cardiovascular health. Without that nightly dip, your arteries never get a break. A study from Columbia University followed over 2,000 adults for 5 years and found that non-dippers had a 36% higher risk of cardiovascular events. I had a patient, let's call him Frank, 67 years old, from Milwaukee. Daytime readings borderline, but a 24-hour monitor revealed his nighttime numbers barely dropped. We cut screens 1 hour before bed, lowered his room to 65 degrees, added magnesium glycinate, and set a consistent wake time 7 days a week. 2 months later, dipping normalized and daytime readings dropped 8 points. Frank told me, "I was fighting this all day, and the real battle was happening while I was asleep." Cool, dark room. No screens before bed, same wake time daily. And the magnesium from number 4 does double duty here. Number 2, sitting still. Not skipping the gym. Hours of uninterrupted sitting. Every hour you sit, your blood vessels lose measurable ability to dilate. A study from Indiana University found that 1 hour of continuous sitting reduced blood flow in the femoral artery by 50%. Think of your vessels like hinges on a door. Keep them moving and they stay flexible. Let them sit and they seize. The same study found that walking 5 minutes every hour completely reversed the effect. Set a timer. Every 60 minutes, stand and walk. And here's the synergy. Combine that walk with the breathing from number 5. Walk slowly at 6 breaths per minute. 2 interventions stacked into one habit. Number 1, nitric oxide. If you remember one thing from this video, remember this. Nitric oxide is a molecule your body produces to signal blood vessels to relax and widen. When levels are high, vessels open, blood flows freely, pressure stays low. The problem is production drops sharply with age. By 60, you're producing roughly half what you did at 30. This is why blood pressure climbs. It's not inevitable. It's a nitric oxide deficit. A study from Wake Forest University published in Hypertension found that dietary nitrate from beetroot reduced systolic pressure by 8 points within 2 weeks in adults over 65. I had a patient, let's call her Gloria, 76 years old, from Denver, 14 years on medication. Her cardiologist said she'd be on it for life. We started a simple protocol: half a cup of beetroot juice every morning, 20 minutes of sunlight on her forearms before noon, because ultraviolet light triggers nitric oxide release in the skin, and nasal breathing throughout the day, because the sinuses produce nitric oxide and deliver it to the lungs. 4 months later, medication cut in half, readings the best in a decade. Gloria told me I thought my body had given up on me. Turns out I had given up on it first. Drink half a cup of beetroot juice daily, or eat 2 to 3 servings of nitrate-rich vegetables, beets, arugula, dark leafy greens. Get 15 to 20 minutes of morning sunlight. Breathe through your nose. This isn't just about numbers on a monitor. This is about your life. Walking with your grandchildren without getting winded. Waking up without that foggy feeling telling you something is wrong. I've watched patients in their 70s and 80s put that pill bottle in a drawer and never open it again. Not a miracle. Information. The right information applied consistently. Your body isn't betraying you. It's responding to the inputs it's receiving. Change the inputs. It's never too late. Subscribe, hit the bell, and share this with someone who needs it. Drop your age in the comments and tell me which of these 7 you're starting first. I read every single comment. Take care of yourselves. I'll see you in the next video.